Hi movers, welcome to ITband 2, where we're gonna roll out the muscles that we stretched. So this video is best used with ITband 1, especially if you have pain at the hip or pain at the knee, which is often due to the ITband and pulling asymmetrically on the muscles. So what you are going to need is a ball, because for rolling we need a ball. I have this cork set from 42 Birds, and I'm gonna leave in the comment section a discount code you can use for this. I like this company because it's very sustainable, and I'm a big supporter of environmental awareness in any company or gear. So we're gonna be using about a tennis size ball today, and we're gonna be working the side of the hip. So you've got a big bone here called the greater trochanter. It's that outside hip bone. And then you've got the top of your hip here, and we're gonna be working this area in between. And a general note for rolling is that you just wanna avoid going over top of the bone. It's not gonna be a crisis if you do, but the thing is it tends to bruise in that area and it doesn't really feel good. So let's stick in the softer spots. I'm gonna do the whole right side of the body, and then you can rewind it and do the whole left side exactly the same. So we'll start by lying on the right side, and we're gonna take the ball and put it under the side of the hip. And just take a moment, use your elbow for support, and then the back leg on the ball of the foot for support, because this area can be very intense. And we're gonna do some screening. So you're just gonna roll till you find an area that is tender, and it likely won't take you very long. And then we're gonna lie our weight into it and try and relax it. So you're gonna put the weight into the forearm, to the ball, and the back foot. And we'll take a couple breaths here. And the idea, as I've spoken about in the other videos, is that we're trying to relax around a hypersensitive point to desensitize that point. Okay, let's find another one. So let's try going a little bit more forward. So you're rolling more towards the front and especially into the side. Ooh, there's the spot. And then again, lean into it. So finding spot 2 in the area of the glute med, or the side of the glute. And now we'll screen for point 3. We're gonna work a little bit more to the posterior. So you're gonna lean back a little. You're kind of getting onto the glute max here too, and then find your spot and lie into it. Whew. Remember, if you're finding a lot here and you need more time, please pause the video and take as long as you need in this area to feel as though you've cleared these trigger points. Okay. Come on off this side glute area, and we're gonna start to work the quad. So you can kind of see where my ITband is here. It's a flat piece of connective tissue. We don't wanna go on the ITband because it will generally cause a lot of inflammation, and what we really wanna affect is the muscular attachment to the ITband. So we're gonna work along the meat of the quad, or the bulk of the quad here, again, staying in an area that is more dense of soft tissue than bone or ligament. So let's come again to our side, and I'm gonna tell you this is gonna be sore. We're gonna start at the top of the quad, whew, and find our first spot and lie into it. So these quad spots are very intense. It would be not a stretch to say that it might be too intense to do on the floor, in which case you can do this exact same thing against the wall. Just sometimes easier to drop the ball. But shh. Okay. And then let's work our way, down to the mid quad. See, this is real life. This is real life quad sensation here. So you want to support yourself with your back foot and your arms. Relax your face. Find that side of the quad where it's attaching into the ITband. And if you find a sensitive spot and you're on some muscle, you're doing a great job. It doesn't have to be perfect location of how I'm describing. And then we're gonna move down more towards the knee, and this, it just gets better. This is the worst part. This is the most tender spot generally that you'll find with your ball. And we'll lie in here. And if anything's way too intense, you can kind of move off that really intense spot, just off to it a little bit, and you're still gonna affect it. So if it's just too much, just move off to the side a little. Okay. Now, if you're like me and that's really intense, we're gonna take a breath break because the quad can kind of take your breath away. And when we go back in, we're gonna work a rolling along the quad and the IT band. Again, please feel free to do this on the wall. It can be very intense. Okay, here we go. So you want some room to be able to move up and down. We're starting from the top, moving towards the knee, and all the way back up towards the hip. Eek. And going towards the knee again. And all the way back to the top of the hip. It's amazing though. You can do this and then do a yoga practice or something, or do your track practice and notice immediately a difference in strength and connection to this muscle. So rolling can be really miraculous in terms of athletic performance. Good. And then we'll come out. All right, good job. That is probably the most intense area that we're gonna work today. And now we're just gonna take some time in the glute max, and especially in the area at the top and moving into the side of the hip. So again, kind of feeling for where the bones are in the back of your pelvis and just wanting to go right underneath it into the meat of the glute. So coming all the way down to the ground. I like to save the stuff that's not as intense for last, that feels really good, so that we can relax and breathe into it. So you're gonna take that ball right underneath the top of the right glute and a little bit more to the side. And just scrolling to find the tender tissue. And once you find it, lean into it, relax your arms. You can use your leg to intensify it or take less intensity out. So if you turn your knee out, you're contracting the glute a little bit, which will put more pressure into the spot. If that's too much, then you're gonna keep it facing the ceiling, and we'll move to another spot. There's lots of goodies in there. I think you'll be able to find what you're looking for. Second spot, leaning in. Invitation to close your eyes. And then we'll find our last spot, moving more to the side. So kind of in the connection of where the glute max, the biggest glute muscle, meets the side glute muscle, the min and the med. It's kind of like Papa Bear, Mama Bear, and Baby Bear. And we'll find our last spot. And the idea, I keep speaking to this, is that there's a hypersensitive area, so the brain is hypersensitive to this trigger point, and we want to create relaxation around it, so we remind the muscle that it doesn't need to be that bound and contracted, and then it'll function better for us, which is what we're looking for. All right, doing one more little just roll around in general, top of the glute, side of the glute, finding if there's any other spots that need your attention and spending a couple more breaths there. The closer you go to the side of the hip is gonna have a bit more of an effect on the IT band in general. And you'll just take as long as you want to finish up that side, and then bring the video all the way to the beginning and do the other side. Even if the other side isn't symptomatic or you're not having problems with that IT band, it's very important that you do both sides. It's very good for the brain, it's very good for the body, and I find this is such a relaxing practice and will enhance your sports performance for sure. Thank you for rolling out ITband 2. Stay tuned for ITband 3.